new survey shows mental health struggles are getting worse for construction workers. 64% of U.S. construction workers say they've experienced anxiety or depression in the past year. Now, that's up from 54% last year. The survey by design build firm Clayco included more than 2,000 construction workers and executives nationwide. But there is good news, and that is the fact that more workers are getting help. Dan Lester is the Vice President of Field Culture and Inclusion at Clayco and joins us now to talk more about the study's findings and what can be done going forward. Thank you so much for being here. To begin with, can you give us more details about the study? For instance, when it comes to men versus women, or which age group might be facing these mental health challenges the most?
Sure. Thank you for having us on this morning, Holly. It's really interesting about the data that we're seeing. A lot of the generations that are kind of mostly infected by these numbers are the millennials and then the Gen Zs. I don't think that's anything surprising with what we know about those groups and how they feel. But, no matter what you say, I think everybody on our job sites is dealing with some of the same challenges with some of the natures of being away from family and traveling and just the hard nature of the work. So some of those factors start to come into the kind of the piece where you really start to look at how workers are affected by the conditions that we work in.
Yeah, so let's talk about that. Why is mental health such a taboo topic in the construction field, and what are some of the factors that may be causing some of this anxiety or depression?
Sure. It's a typically stoic culture, right? There's a lot of pride with the work that people do, and it typically is male dominated, and that's a toughness, that's valuing of toughness in the industry, right? So sometimes that's great for other places, but sometimes can be difficult when it comes down to talking about how you feel, what's going on, because those things can be sometimes viewed as signs of weakness.
You mentioned millennials and Gen Z, that they are more likely to report how they're feeling. Is that sort of maybe a sign of the generation that is more open to talking about feelings? And we know that therapy used to be a taboo topic once upon a time, but now that more people are saying, look, this is actually healthy.
Yes, the millennial group is probably the largest population in the workforce right now. So they have different needs and wants than the baby boomers and the Gen X that came before them. So it's time for us to really start looking at how we can do it. But here's the positive thing. While many folks have the numbers are up as far as those who are reporting having issues, the numbers are also up at about 10% from last year for those who are actually seeking help for their issues and those who are getting some sort of medication for those issues. So the positive thing is that while those folks are talking about it, they're also receiving some of the supports and benefits needed to get there.
Looking at your study, I found a statistic interesting that executives in the industry admitted that those who come to them with mental health issues were less likely to be assigned to important tasks and perhaps more closely monitored. Why is that?
I think sometimes it's just a natural thing when people report. You want to kind of cover yourself from issues. It could be well-meaning, right? You definitely want to support folks and make sure you're paying attention. What we don't want to see is negative retaliation. And some of the studies showed that, there is some level of folks who are getting support that receive, about 37% of those folks said they received some sort of discrimination or retaliation for reporting or saying that they needed help. And that's what we really have to use this data to really find and support. And so that's what Clayco is doing. We want to really use this data to try to find a way to create a psychologically safe environment where we reward vulnerability and we make it easier for people to come forward and say what they need and that they need help, and that we find a way to get them the support they need without the fear of losing their job or not having a meal for their families tomorrow.
Yeah, does it concern you that hearing these statistics and finding out this information that people who need help the most won't get it for fear that their jobs or careers might be negatively affected?
Well, I think that what we have to do is change that narrative, right? I think the more we talk about it, more people will come forward. Then we have to kind of put the programs and policies in place that make sure that when people speak up, it's a safe place, and that we have some sort of return to work policy. We work on recovery-friendly workplace initiatives and find ways to support those folks that when they come back, they can come back in a healthy way, in a positive way, and hopefully and fully supported by their teams so they can re-enter and be fully engaged.
And so overall, what is this telling you? What is all this information giving you, and what's the message?
Well, the message is, and I'm excited about our partnership with the National Alliance for Mental Illness, NAMI, because they're going to really help us kind of create some co-branded resources that are specific for construction with the nature of psychological safety and how we support each other at work and what we can do that's going to make a meaningful and lasting impact. And we hope the industry adopts this and takes this information and uses it so they can better serve their folks on their job sites, because we are all in this together and we need folks to be able to come to work safely and go home the same way that they came.
Absolutely. Dan Lester, Vice President of Field Culture and Inclusion at Clayco, thank you for joining us and bringing this important topic to light. We appreciate it.